Welcome back. It's Wednesday, and today we're going to talk about degenerated disc. Earlier in the day, we had a patient that we talked about her outcomes, and she was suffering from a degenerated disc. Actually, we have 600 case studies now. We're up to 600, and 75% of our case studies have degenerated disc. So it's a big problem. So we want to address what it is because a lot of people don't quite understand what the degenerated disc is. So we're going to talk about that today. Now, to understand what the degenerated disc is, you have to really understand where the disc is in the whole function of the spine. So typical spine looks like this. The head would be up here, the hips would be down here. There's 24 vertebrae between the head and the hips, and the vertebrae are the bones. And in between each bone there is a disc. And the disc allows for motion. Forward, back, side to side, and rotate. 6 directions of motion. All that motion takes place on top of the disc. So there's 24 vertebrae, and then in between each vertebrae there is a disc. Kind of looks like this guy who's moving around over here. Now, inside the spine is the spinal cord, and this is important because when you have a degenerated disc, sometimes it affects the spinal cord. So the spinal cord runs down through the inside of the spine. And there's little openings between each vertebrae for a nerve to exit. And the nerve exits through this opening, right through here, what we call the foramen. So the spinal cord runs down through the inside of the vertebrae, and then the nerve exits through the opening here called the foramen. Now, the foramen is really the result of the vertebrae, one on top of the other with the disc. So the space of the foramen is really held open by the disc. So what happens is that disc can get a little bit thinner as it degenerates, and that opening physically gets smaller. So we know 24 vertebrae, between each vertebrae there's a disc, spinal cord on the inside, and the nerves in the neck go into the arms, and the nerves in the low back go down the legs. So if you have a pinched nerve in this area right here as a result of a degenerated disc, which is one of the causes of sciatica, very often you'll get pain that goes down the leg. Not every time, but it's very common that you can have a degenerated disc and start to have pain that goes down the leg. So it's important to understand that. Now, the disc is a lot like a jelly donut in the sense that the outside of the disc, there's a thick material. That thick material we call the annulus. It's cartilage. One vertebrae on top of the other. Here's the disc right here. So the outer portion of the disc is the annulus. It's thick. The inner portion of the disc is the nucleus. That's like the jelly on the jelly donut. The jelly inside the disc gives stability to the outer portion of the annulus. So the jelly gives stability to the outer portion the same way air gives stability to the tires on your car. So when the tires in the car are properly inflated, the tire is more stable. But as the tire starts to run out of air and you develop a flat tire, the tire is less stable. Same thing with this nucleus. The nucleus gives stability to the annulus. But what happens is this nucleus will start to dry out. As the nucleus starts to dry out, what happens is you start to overload the annulus. And as you overload the annulus starts to break down under the load. The disc is unique from the point of view that it is the largest avascular structure on the body. What does that mean? It means that there are no veins or arteries that run directly through the disc because the disc is under a great deal of pressure. I weigh 200 pounds. In an upright position, standing up, I'll have 120 pounds of pressure, roughly, on my disc. So much pressure that blood won't flow through it. It's kind of like stepping on your garden hose trying to get the water through. Well, it's not going to get through. There's too much pressure on there. So the disc relies on a network of arteries. And the network of arteries runs up and down the outside of the spine. And this network of arteries on the outside supplies the outer 1/3 of the annulus all the way around the disc. And more importantly, the inside 2/3 of the annulus and the nucleus gets its blood supply from a network of arteries that runs through the inside of the vertebrae. And this network of arteries that runs through the inside of the vertebrae allows for the migration of the oxygen and nutrients and hydration necessary for the health and the stability of the annulus and the nucleus. What can happen over time is you can get a decrease of flow across the end plate. And when you get a decrease of flow across the end plate as a result of abnormal motion very often, wear and tear, as you decrease the flow, the nucleus starts to dry out. And it's the drying out process of the nucleus that causes the disc to degenerate. It's not easy to say. The disc degenerates because it's losing its fluid. And the nucleus, the jelly, is getting drier. And it's kind of like letting the air out of your tire. And what happens is the vertebrae start to get closer together. And as it gets closer together, the little opening in the back, the foramen, where that nerve comes out, physically starts to get smaller. But also what happens, as you start to increase the load and the nucleus starts to dry out, as the nucleus structure becomes a little bit more tough or harder, it starts to aggravate the end plate of the vertebrae. And the aggravation of the end plate of the vertebrae causes an inflammatory process where you get decreased flow across the end plate. And that inflammatory process, we call it modic change. You can see these on an MRI. And you get a change in the way this functions here, and it gets inflamed, and that can be painful as well. So the breakdown of the tissue of the annulus under the load as the nucleus dries out causes pain. But also you can get some subtle changes in the end plate of the vertebrae where it becomes swollen, and that swelling can be painful as well. Now, this is kind of what it looks like. One vertebrae on top of the other with the disc in between. Here's the spinal cord in the back. Okay, so the spinal cord would be inside this canal right here. Kind of what we talked about. The spinal cord would be right here. Healthy disc. Typically smooth transition from one vertebrae to another. This is from a cadaver. This is cadaver bone picture. But you can see here, one vertebrae on top of the other, this disc is degenerating. And as it degenerates, what happens? Well, the vertebrae are getting closer together. As the vertebrae get closer together, the opening physically starts to get smaller. We talked in one of our videos before about the 5 causes of sciatica. Well, one of them is the degenerated disc. It's very common. That degenerated disc, what happens is the vertebrae start to get closer together and it starts to pinch that nerve. That process causes back pain but also causes the sciatica. So you can see what happens is vertebrae get closer together, but also what happens in some cases, the vertebrae get closer together and then the annulus starts to push out. This is the annulus pushing out. Well, why is the annulus pushing out? The annulus is pushing out because it's got nowhere to go. There's nowhere to go but out. Okay? This is a bulging disc. This is the bulging disc, degenerated disc, bulging disc, but also what it does is it creates a narrowing of the opening. And that narrowing of the opening where the spinal cord is in the back, that's called stenosis. That's another reason. But typically it's the breakdown of the disc where it's degenerating and getting closer together that causes everything to start to break down. Okay? So when you start to lose the fluid inside the nucleus, the vertebrae start to get closer together. Now, you can see that on an MRI. Healthy nucleus with the proper amount of fluid on the T2 sagittal view of an MRI, which is what this is right here, side view. So we're looking at it from the side, like this. One vertebrae on top of the other. Here's the disc, spinal cord's in the back right here. A healthy nucleus that has the proper flow of oxygen and nutrients and the proper hydration will be white or whiter or a shade of gray. Okay, because water, which is part of what is the hydration of the nucleus, will show up on an MRI in the nucleus, this view here, as whiter. So you can physically see it. Now this is white back here because there's cerebral spinal fluid surrounding the spinal cord. Okay? One vertebrae on top of the other, healthy nucleus. What do you get? A smooth transition. Everything looks good. As we get down here, you can see bulging disc. But also what's happening is it's darker. Why is it darker? It's darker because it has less fluid. So you can see the beginning stages of the degenerated disc, which is what's happening right here. Okay, same thing down here. Get a bulge, a little bit of a herniation here. But what happens is this wear and tear, as the vertebrae get closer together, you'll get wear and tear on the annulus. And that wear and tear on the annulus is an inflammatory process. Start to develop a little inflammation. Inflammation causes pain. Tells you there's something wrong. Also, what happens is there are little nerve endings, and those little nerve endings start to get aggravated right here. It's called the sinovertebral nerves, and they're responsible for telling the brain there's something wrong. When you have a bulging disc, that's where you feel it. When you tear through that with a herniated disc, that's where you feel it. Okay? So in this particular case, with the degenerated disc, vertebrae starting to get closer together, you start to aggravate those nerves, and you'll develop a little tear. So it's kind of a cascade. It's a cascading event. It cascades into dysfunction and instability, and you can see it. Now, what I said earlier is we have 600 case studies of patients. Okay, our goal is to get to 1,000 by Christmas, but of our 600 patients, and these are chronic back patients, these are severe back problems. These are not simple back problems. 75% of our patients have herniated discs. They have other things. They have sciatica, and they have bulging discs, and all the things that go along with that, and stenosis. But it's a very, very, very common problem. And we treat it, and we treat it without drugs or surgery, and we treat it very effectively. If you didn't see the video in the morning today, we did a video on outcomes. Okay, outcome is what happens when you get the treatment. How much better are you? So part of what we talked about earlier was her degenerated disc. This is what it is. This is the degenerated disc. I had a severely degenerated disc. My back pain was an 8, and it was an 8 for 3 years, and I had back pain for over 10 years. And I couldn't do anything. I couldn't even lift luggage. I couldn't golf, but now I can do all those things, and I can do it without any pain at all because we get patients better. And that's we discovered something as I worked on myself that now is changing the world. So that's what we do. So tomorrow I want to talk a little bit about my MRI. I'll show you what that looks like. So if you like what you hear today, if you like us on Facebook, you'll get automatic reminders that we're going to be live, or it tells you when we are live. Same thing with YouTube. If you like us or subscribe to our YouTube channel, it'll tell you when we're live. So thank you very much. Have a good night. If you've got a degenerated disc, we can help you. Drive safe, be careful, and if you live in Chicago, it's going to be really cold tomorrow, so stay warm. Goodbye. Good night.